Good evening and welcome to our COVID-19 update. I am Ladi Akiriduluale here at the highlights at this hour. Federal government reassures it is ahead of the curve for possible recession, touts over 2 trillion naira stimulus package for the economy to cope with COVID-19. Education authorities plead with ASU to be reasonable as plans for tertiary education possible resumption are considered. And worldwide death toll from COVID-19 surpasses 750,000. The Presidential Task Force on COVID-19 briefing took a different format today, as its chairman and secretary to the government of the Federation, Mr. Boss Mustafa, began by welcoming back the Foreign Affairs Minister, Mr. Geoffrey Oyama, who had just recovered from COVID-19. The PTF also appeals to Nigerians not to lower their guards with the low cases of COVID-19 recorded in the past 2 weeks. On the efforts by the federal government to boost the recovery of businesses in the COVID era, the FGF asked all levels of business operators to embrace the opportunities provided.
Our government had put in place an economic sustainability plan backed by a stimulus package in the sum of 2.6 trillion naira to boost local economies, production, and for all sizes of businesses, including small family businesses. I therefore urge our businesses to take advantage of the stimulus package to revise and or boost their businesses. We cannot afford to let our economy slide. The Presidential Task Force wishes to note, as we have done before, that fewer numbers of confirmed cases have been recorded in the last 2 weeks. This should never be misconstrued as victory over the virus. There is still a serious battle to be fought ahead of us as a people and as a country. It is important, therefore, that we continue to build on our successes and not do anything to detract from them. I wish to note, however, that from reports for yesterday, 12th August 2020, no fatality was recorded. The Presidential Task Force is pleased to associate with the celebration of the International Youth Day 2020 under the theme, Youth Engagement for Global Action, which seeks to recognize the immense contribution and the role of our young people in achieving sustainable peace and development across all levels. Implicit in this is the need to galvanize engagement of youth to significantly enhance peace building, to promote social cohesion in this era of social distancing, and collectively fight in containing the COVID-19 pandemic.
Staying with the PTF briefing today, the Minister of State for Education, Chukwuemeka Nwajuba, says all modalities are in top gear to allow for the resumption of tertiary institutions across Nigeria. Speaking on the prolonged strike by the body of university lecturers, ASU, Mr. Nwajuba explained that members of the association are responsible senior lecturers who know what is healthy for Nigeria and its students. Mr. Nwajuba was emphatic that the lecturers would be reasonable.
ASU is the foremost union in the universities, and over the years, through their engagement with government, they have achieved a lot for the education process. At the moment, they declared a strike action in March, ahead of Corona's own strike. So, while they were on strike, Corona struck. And both of them have kept all our children at home for the past 5 months. It will be up to the national body here, because we are working towards a national response. Once the PTF assesses all the data around the science that is coming up as it evolves, it would then inform us whether to open the education space to at every strata. Today, I met with the proprietors of private universities around Nigeria. Their argument is that markets, churches, everywhere else is open. Why shouldn't their own private universities open if public universities and institutions do not want to open because of access? And I told them that's a continuing engagement, because everything that ASU is asking for is also for the welfare and uplifting of the university system. However, we have run into an emergency, and we would need to do a lot more than just do strikes to get our children back on stream. So the appeal that has been made by a lot of well-meaning citizens to ASU is maybe they should give a moratorium as to strike action for the next 10 years so that Nigerian university system can rebuild before we start further agitation. But that is also something that people will take into context in what it is that they are able to achieve.
State governments are being asked to prioritize sample collection and testing for COVID-19 as most laboratories across the country remain underutilized. And that's according to the Presidential Task Force on COVID-19. The head of Department of Surveillance and Epidemiology of the Nigeria Center for Disease Control, Elsie Ilori, says the recent low cases of COVID-19 reported by the center should not be misconstrued for victory over the virus, as there's a growing apathy for testing.
In terms of the voluntary testing, I think there's in Abuja we had several prevalence surveys going on. I went on in Abuja. That survey has they just concluded that survey. That was using the blood sample, and that's just for us to know the prevalence of COVID within the community. It's a survey, and we're going to go to other states to do that. Something that is still ongoing, so we do not have the results yet. Then in terms of the local government, yes, of course, when you want to prioritize, you look at those that are really not performing well, and so you prioritize those. So our target is to make sure that those 85 local governments that have not tested at all, if not collected samples, we'll prioritize them. And then, of course, the states are the ones that are implementing this. We're working with the states, and we have used FCC as a pilot. Now we have the strategy. Some states have actually started, like Lagos State, they have started. Some other states have started, Kano State, for example, also has started decentralizing sample collection in the state. So we're going to work with the states and make sure to support them to make sure that they're able to do this.
Even as the world celebrates the International Day of the Youth, the Minister of State for Health, Dr. Lauren Mamora, has been speaking on the need for the youth to take the COVID-19 pandemic situation seriously and protect themselves from possible infection. Dr. Mamora also asked all health workers to at all times make use of the personal protective equipment to reduce healthcare workers' infection.
I wish to commend our youth who have supported community mobilization and risk communication through social media and community engagement. This pandemic has had its impact on our young people. The evidence available to us shows that 46% of COVID-19 cases in the country are young people between ages 21 to 40. I will therefore appeal to our youth to take responsibility for their health. Let us ensure that we adhere to the advisories of wearing face masks appropriately, regular hand washing, and ensuring respiratory hygiene. We are concerned by the resurgence of infection in healthcare workers. In a bid to sustain the gains we have made in reducing the rate of infection among our health workers, we have made training and retraining of health workers on infection prevention and control a priority.
Health workers are vital to winning the war against COVID-19 the world over, and it's never pleasant to hear the possibility of an industrial action or strike. Here in Nigeria, the leadership of the medical and health workers unions insists that there's no going back on their planned industrial action if the federal government fails to include its members in the third phase of payment of the Special Hazard Allowance for health workers. Addressing journalists on the sidelines of a meeting with members of the union in Abuja, its president, Mr. Biovele Monye Jafar, insists that although the union will keep the doors of negotiations open, it will not continue to tolerate discrimination against its members.
Certainly, we are service-oriented. We are trained to give service. But the first principle of giving service should be that you should be alive, you should be well cared for, to be able to give what you are given. We entered into agreement with the Federal Minister of Health, where the Federal Minister of Health also agreed that there was error in the implementation of the COVID-19 allowances. People who are earning 5,000 that ought to have been prepared on 50% were given 10%. And we, in our traditional way, we didn't immediately rush on to strike. We engaged government, and government has seen that reason. We are believing that, and we hope they will do so. Before they pay the third batch, that correction would be made. Thank God the press is here. I want to make a very bright appeal to Nigeria, the Federal Minister of Health, as well as the Nigerian government. Do not lead us into temptation. We have been patient. That does not mean we are weak. What we are saying is treat us properly, so we can also dispense proper treatment to our citizenry. I am not going to close the door on dialogue, but dialogue cannot be inexhaustive. But where we begin to see that they now ignite our appetite to distrust government, we will not hesitate to distrust, and then that will be the signal for war.
Infection prevention and control, IPC, is one of the practical ways to eliminate harm caused by infection to patients and health workers, particularly in hospitals or healthcare settings. As the COVID-19 pandemic continues to test the resilience of health systems around the world, the World Health Organization is giving guidelines on how to prevent human-to-human infection among healthcare workers and patients through water, sanitation, and hygiene services, including waste management and environmental cleaning. Poor infection prevention and control leads to health-acquired infections, transmission of diseases from health facilities to communities, increasing the use of antibiotics and exacerbating outbreaks, as well as the spread of infections, in this case, COVID-19. Joining us via Skype from Jos, the Plateau State capital, to look at how to prevent infection and reinfection in Nigeria's healthcare facilities is a professor of medical microbiology who is the head of the Department of Medical Laboratory Science at the University of Jos, Professor James Damen. Good evening, Professor. Thank you for your time and welcome to the program. Okay, we seem to be having some difficulty with Professor Damen's audio. While we try to get back to Professor Damen, let's find out what the Lagos State government is doing about its own students, even as they prepare for exit exams. And indeed, the authorities have said students in state-owned schools may be promoted to the next level with their continuous assessment tests. This is coming from the Commissioner for Education, Mrs. Folashade Adefisayo, who told Channels Television that the state government is communicating with the federal government to determine steps that will be taken in terms of school resumption.
The reopening we're doing is actually, we're working with the federal government. And so and with all state commissioners. So I would not unilaterally like to say we are doing this or that, but we are planning. And if we do not, there are two different scenarios. We don't scrap third term, they come into third term, but that means that we push next session to next year. So again, each one has its own complexities, and just be assured that we will do what is best for the students. One thing we're certain of is that if we do not do the third term exams, they will use their CA. Remember, it was second term. This thing started in second term. So they have CA and exams for first term. They have CA for second term up to a point. And when they come in, we can actually have a kind of baseline assessment for all of them. And that's what we would do in our schools. In the public schools, we're going to have a baseline assessment, determine where they are before we promote them to the next class. And while I cannot give definite dates for now, I'm certain that we're going to keep on opening a bit more each time.
From Lagos, let's go to Bauchi, where residents of the various communities in the state have been undergoing testing for COVID-19 virus. Let's get an update on that and more from our correspondent, Hajara Ali.
3 weeks ago, the Contact Tracing Committee on COVID-19 in Bauchi State commenced community testing in 3 local government areas of Bauchi, Bogoro, and Kirfi. The local government areas have an estimated population of 1.1 million people. So far, 2,020 samples have been collected, and out of the samples, only 28 tested positive for COVID-19. The state government says it is carrying out what it calls targeted community testing, and this means that only people in communities with high number of COVID-19 cases will be tested.
This is a pilot. We're now looking at what are the challenges that we face during this community sampling. We find out that we have an informed consent. People will sign that they agree to carry out the test. They will sign, give their telephone numbers, everything. That's the format the NCDC has given us a directive. But after the sample was collected and the result was out, during evacuation they decline. That's the biggest problem we have. So we have to use the security agencies. In some places we use the local government chairman, and then in some places community leaders before we evacuate these patients. And some of them that came, about 13 of them from one community that came, there was a lot of tertiary in that community. They ran away again in the desperation after 4 days. After taking treatment for body, they ran away. So it was a big an issue to us because they are going to their farm, and so they were sick. When they came, they really know that they are really having signs and symptoms of COVID.
The State Task Force Committee on COVID-19 is extending the community testing to 3 more local government areas of Toro, Wariji, and Gandua. And this is to ensure that the state meets the directives of NCDC that every state should at least test 100 people per day. From Bauchi, Hajara Aliu for COVID-19 updates.
We'll take a break now. When we return, we hope we'll be able to establish contact with Professor Damen, as well as bring you the latest figures from the NCDC on the state of COVID-19 in the country. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. I understand now we can talk to Professor James Damen, who joins us via Skype from the Plateau State capital, Jos. Professor Damen is a professor of medical microbiology and is the head of the Department of Medical Laboratory Science at the University of Jos. Good evening, Professor Damen. Thank you for your time.
Yeah, good evening. I'm happy joining you from here, from Jos.
Thank you very much. The World Health Organization points out that 1 in every 10 patients gets a recurring infection while receiving treatment for something else in a hospital environment. What can you tell us about the situation with Nigerian hospitals?
Yeah, thank you very much. You know, the major problem is actually for us to be able to observe what we call infection prevention and control. We call it IPC. And this, for us to be able to observe the infection prevention and control, it has to go a long way in preventing reinfection. The major problem we have is that government is supposed to provide available personal protective equipment and in all our hospitals and also in our isolation centers, where before a health worker will actually see a patient, you have to protect yourself. The main aim of protecting yourself is, number one, if the health worker is having any infection, it will go a long way in preventing that infection to be transferred to the patient and also to prevent the patient that is having an infection to also affect the health worker and to also prevent the environment and also for people, patients, relations, and also visitors that are coming into that environment. If that is not put in place, then you are sure that there will be infection that will spread and anybody can be infected. You recall that we had been making a lot of complaints. Our members, the healthcare workers, are seriously infected because we don't have enough personal protective equipment in our health facilities and also in the laboratories where these investigations are actually carried out. You recall that some of the laboratories that are actually used to do the COVID-19 testing, where the whole facilities were even infected, and the place has to be closed down until the place has to be fumigated before they will now resume testing. And so the major problem of infection is when infection and prevention control are not effectively taken care of. Now, two things here. Number one is to provide all that is needed, personal protective equipment. And the second thing is for health workers, which I know that government has also tried to build the capacity of the health workers to ensure that these personal protective equipment are adequately used for them. Now, the other issue we have is that in every hospital, we are expected to have a committee of IPC. And in most cases, the laboratory is actually the center. And in most cases, you discover that the medical laboratory scientists that play a very key role to even determine what type of infection and to also come up with how those infections can be prevented, they are usually not included in those committees. And once they are not there, then definitely you know that the committee cannot be able to discharge their responsibility effectively. The laboratory is actually very cardinal because that is where investigation, finding out the various infective agents are actually identified. When we talk of bacteria, now the bacteria are usually identified in the laboratory, and the medical laboratory scientists go further to also identify the antibiotics that are actually susceptible, the bacteria is susceptible to the antibiotics. And when these are not properly done in the laboratory, then definitely you discover that even the patients that are infected, they cannot be properly treated. And when we have resistant cases, there are many implications. Number one is that the patient has to stay longer in the hospital, the cost of treatment will be very high, and then we are also increasing the rate of mortality of the patients in the hospital. And the key thing we need to do is to make sure that all those personal protective equipment that I have listed before has to be put in place, and then the right people, the medical laboratory scientists, has to be involved in the IPC. And apart from even the central ICC committee of the hospital, in the laboratory, you are expected to also have that unit too, where these procedures have to be adequately adopted to prevent reoccurring infections.
Indeed, Professor David, you took on 3 of the 4 questions that I already had penciled down for you. So I'll just go straight to the 4th one and ask you about that. You did mention in the course of your answer, you did talk about waste generation and management of it. For example, in the labs where they carry out tests for COVID-19, after you determine whether or not the person is positive for COVID-19, what happens to the sample? How is it supposed to be disposed of? Indeed, other test results, other test samples, other hazardous waste generated by medical practitioners in the course of practicing medicine, how are those currently disposed, and how should they be disposed of, given the era in which we are, given the fact that, as you pointed out, there are resistant ailments, antibiotics, and indeed other resistant ailments that are now in the process?
Yes, for any laboratory to be given accreditation to conduct COVID-19 testing, there are what we call protocols. You must satisfy certain conditions before your laboratory will be given accreditation to perform that investigation. This is because the waste are actually very infectious, and so you must have what we call incinerator. And the incinerator has to be, it must be functioning. And so you know that the NCDC, in collaboration with the Medical Laboratory Science Council of Nigeria, they must definitely come to your facility and inspect the equipment, the setting of the laboratory, including the waste management, because containment is the key thing. And so when you don't have incinerator, definitely that laboratory cannot be given approval to conduct COVID-19 testing. And so the incinerator is actually a place where you have machines that can actually destroy all the waste that are generated as a result of performing the investigation.
All right, then. Indeed, these are very serious points. But we do know that in the process in Nigeria, that some of the institutions managed to slip through the cracks. And that brings me to the other issue I wanted to raise, which is, in everything you've said, the hygiene processes, one big thing stands out, and that is the issue of water. Earlier this week, we discussed the availability of water, the importance of water in all of this. How have the hospitals fared with that? I know many of them have to make provision for their own water, but how convenient is this, and how vital is this for the process of hygiene in the hospital system?
Yeah, water is actually very key. You remember that we said the simplest way of hygiene is hand washing with soap. And you cannot do hand washing without water. Your hand washing has to be done when you have running water. And so the challenges that most hospitals have is that they don't have reservoir, and then sometimes too, for those that are connected to water board, you always have problems of supply of water. And so most of them, they have to improvise, having overhead tanks where they have to make arrangements for tankers to bring water, and then those waters have to be put into those tanks and then they use. It's actually a challenge. I have actually visited some hospitals, including even those ones that are here. Their major complaint is constant availability of water is a challenge. And so these are areas that government and also spirited individuals should be able to see how they can also support those various centers that are performing this important task. And without this water, then you know that there is actually a problem. And then apart from this water, we have made mention of the personal protective equipment. You have the lab coats, the gowns, you have the face shield, you also have the face mask, and even the boot too, they are all part of what a health worker actually needs to be able to maintain proper hygiene and also to protect himself or herself from getting infection with COVID-19 and other infectious diseases. Remember
Thank you very much, Professor James Damian. It's been a pleasure having you with us on the program and sharing your perspective. Professor Damian joined us via Skype from Jos, the Plateau State capital. Thank you so much for your time this evening. Let's look at the latest COVID-19 figures from the Nigeria Center for Disease Control, beginning with the Cherry News. For the first time in almost 3 months, no life was lost to COVID-19 within the last 24 hours. The last time Nigeria recorded no fatality was May the 23rd, when the NCDC reported 265 new cases and 167 discharges. Total confirmed cases have climbed to 47,743 as 453 samples came back positive across the laboratories in the country. 334 new discharges mean almost 34,000 people have been discharged nationwide, while the fatalities remain unchanged at 956. A breakdown of the latest numbers show 15 states and the Federal Capital Territory account for the 453 cases. Lagos has 113, the FCT has 72, Plateau has 59, Enugu 55, Kaduna 38, Ondo 32, Osun 26, Ebonyi 20, Ogun 9, Delta 8, Borno 7, Akwa Ibom 6, Oyo 5, Bauchi, Kano, and Ekiti have 1 apiece. The NCDC also announced the inclusion of the General Hospital on its Anambra State to the NCDC Molecular Lab Network, bringing to 63 the total number of labs with the capacity to test for COVID-19 in the NCDC Lab Network. The Nigeria Civil Aviation Authority, the NCAA, has approved the reopening of the Asaba International Airport for commercial operations. The approval was conveyed to the Delta State government by the NCAA after it ascertained the level of preparedness for its reopening pursuant to the federal government's lifting of the ban on local air travel in the wake of the COVID-19 pandemic. The NCAA explains that the Asaba International Airport had satisfactorily fulfilled the requirements of the COVID-19 restart guidelines and protocols, and therefore had been granted the authorization to resume normal operations. While thanking management of the aviation regulatory body for their promptness and professionalism, the Secretary to the Delta State Government, Chioju Ebie, assures air travelers using the airport of the continued commitment of the government to the provision of modern facilities for effective and efficient operations. Let's take a further look at the issue of infection prevention and control practices in healthcare facilities in Nigeria. Joining us to discuss this is Professor Charles Tobin West of the College of Health Sciences at the University of Port Harcourt in Rivers State. He joins us via Skype. Good evening, Professor Tobin West. Thank you for your time this evening.
Good evening, and thank you for having me.
Many people skip the issue of hygiene in the hospital system, particularly on the patient side of things, and then those, of course, on the health worker side of it, due to what several people have described as challenges. Things are allowed to slide. The issue of cleaning of surfaces, regular disinfecting of common areas, and all of that. Would you say that Nigeria is complying largely with this? Is our hospital system up to date with this? Are we complying with this in terms of international best practices?
Well, actually, I will not say we are complying. As a developing country, we have our challenges in the healthcare system, just as we have elsewhere. But we are trying the best we can, because in many instances, supplies are short, and in some other instances, you have a lot of negligence. Things like bacteria are usually not very visible, and healthcare workers are quick to disregard safety rules, and of course, the result is hospital-acquired infection.
Now, let me give you a few statistics here, as part of what we need to use to develop the discussion. Between 1995 and 2010, it's divided into two groups. You have what you might call the high-income, highly developed countries, where you have Canada, Finland, the United Kingdom, and Switzerland, all having fairly good rates, very low rates of infection within hospital systems. And then you have those who might be more in Nigeria's bracket, the likes of Mali, Morocco, Senegal, and Ghana. The percentages in this case are a bit higher. In the case of Mali, for example, 18.7%. In the case of Morocco, 17.8%. In the case of Senegal, 10.9%. And Ghana, 6.7%. Now, Nigeria's figure is not captured in that report, which was 1995 to 2010. Nigeria's figure is not captured in the report, maybe because we didn't have the stats available to feed into the report. But I bring that into the discussion because I want you to talk about some of the difficulties that there are, which you alluded to, in view of COVID-19, which we are told is highly contagious, highly infectious. So the state of hygiene becomes a central issue.
Yes, actually, the state of hygiene is an issue. Reason being that, just as I said earlier on, we don't, in some instances, in some cases, we don't have all it takes to get ourselves protected. And in some other instances, we just find ourselves doing things that are not right. Well, in terms of COVID-19, I think initially at the inception, when the epidemic started, it caught several hospitals off guard, and with time, a lot of hospitals were able to restock the PPEs and all that, then put other administrative controls in place, and we are coping better. But I won't say we are there yet, because if you look at the stats, you find out that a lot of healthcare workers are infected, over 1,000 in the country. And so we need to do more. We need to do better. We need to actually do better.
What should we be doing? What should we be doing? Professor Tobin West, what should we be doing now?
Yes, we should be doing some form of surveillance. We should be ensuring compliance. People are quick to disregard rules and compliance and things like that. But when we put up the surveillance system, the IPC, that infection prevention and control system in the hospitals, the infection and control team should be on guard to ensure compliance. And so the administrative, actions can be taken. Of course, making sure also that the requisite prevention and control consumables, I call them consumables because they are disposable, most of them, right, are in place. Because, they are disposable, and at times, because of financial challenges or other, limitations in resources, people tend to economize their use and in the process, endangering themselves as well as the patients they are supposed to care for. So we need to do more than what we are doing presently.
Thank you so much, Professor Charles Tobin West, who is a consultant community medicine physician at the University of Port Harcourt. Thank you for your time this evening and for your perspective on this very important issue. Thank you so much for joining us.
Thank you for having me.
Beyond our shores, as many Nigerians are stranded in the United Arab Emirates, and as they are lamenting the state of their affairs, an additional 1-month extension of visas granted by the United Arab Emirates government brings some relief. This comes as chairperson of Nigerians in Diaspora Commission, Mrs. Abike Dabiri Erewa, says the federal government is working to get help to them soon. This somewhat good news, however, does not do much for residence visa holders who have had difficulty renewing their papers. Bayawa Adegoke, our correspondent in Dubai, brings us an update.
Scores of stranded Nigerians who spent days camping at the Nigerian consulate in Dubai have been moved to better accommodation by local authorities who will facilitate their return to Nigeria.
The UAE government has helped us so much, and they have given us an accommodation in a hotel, a very good accommodation. They say we should wait in 4 or 5 days that our flight will be vacated to Nigeria. We slept in the Nigeria embassy consulate. I spent like 3 days or 2 days to be precisely. God just answered our prayer, so I appreciate God. I thank you.
This new development comes on the heels of UAE government's announcement of a 1-month extension for holders of visas which expired after the 1st of March. An earlier directive ordered them to vacate the country by August 11. Stranded Nigerians in various parts of the country want government-sponsored evacuation or the reopening of Nigeria's airspace for commercial activity to allow them use their existing return tickets.
The situation is getting worse because many people still want to go. Either the extension is given or not, many people want to go. And we are trying to the government to please open the airport. I think that will solve the problem.
Meanwhile, Nigerians holding residence visas seem to be having their own share of the challenges.
Some residences in some Emirates are being rejected, while some are being approved with with a police clearance, while others are still pending on the system.
A statement from the UAE's embassy in Nigeria's capital, Abuja, denied reports that Nigerians are being banned from entering the country, attributing restricted travel between both countries to Nigeria's locked airspace.
In fairness to them, when the airspace are being opened, they're going to reconsider better ways to get visas issued. But however, on ground, when you look at renewing the visas of those who are in United Arab Emirates, the one we call the visa change or visa extension as it is, that is not possible, right now as we speak, for Nigerian nationals. So that's the reality on ground. And relatively, no clear-cut statement from the UAE government here to say it's not, we're not going to issue visas. But again, when you go to the system to apply, it tells you it's not, it will not go through. So that means technically it's been stopped.
In the meantime, Nigeria's Presidential Task Force on COVID-19 recently approved 5 more flights for the UAE. Also, the PTF said aviation authorities have been given the go-ahead to commence the process for the resumption of international flights. How soon these flights will commence is yet unknown. From Dubai in the United Arab Emirates, Mayowa Adegoke for Channels Television News.
Let's talk to Mayowa now. She's joining us from Dubai in the United Arab Emirates. Good to see you, Mayowa. Welcome.
Thank you very much.
Let's look at the issue of the stranded Nigerians versus the evacuations. There seems to be a lot of moving parts in the story. First, we hear that, of course, there are stranded Nigerians. Then the information came out that the Nigerian government is sending planes. And now your report says that actually, according to some of those stranded Nigerians, it's the UAE government that is making some arrangements for them to come home. What is it exactly that you can tell us with some level of certainty, if anything?
So, with some level of certainty, I can tell you that the Dubai government particularly has sponsored at least one flight categorically, because yesterday the Emirates flight that landed in Nigeria, bringing 292 Nigerian citizens, was actually one of those flights, from information that I have, sponsored by the Dubai government. None of those guys on board paid a dime to be on that flight and to return home. And many are looking to get on such flights. So in the past few days, the Dubai government has also done a lot to sort of clear out stranded Nigerians living on the streets. I know that last week I did mention that a lot of people are still out there on the streets. A lot of people camped outside the consulate, just trying to vent their frustration and showing their desperation as well.
So many of these guys are being cleared out of the streets and they're being admitted into camps, humanitarian camps by the Dubai government. And this I hear is happening all across in other emirates as well. And I visited one of these camps earlier this week, and I see that, number one, very good accommodation is being provided for these guys. Many eyewitness and beneficiaries testify that they're being fed 3 times a day, and they're being housed there until there's another flight ready to take them back home. A lot of Nigerians are looking to get into these camps because it seems as though once you get into that camp, then you've got a free ticket back home. Regarding the announcement by Honorable Aditya Gabriel Erewa that there are flights coming, well, there's yet to be an announcement from the commission here, so we'll be looking out for that. And I'm sure that when that happens, it will be great news. But as we speak, what I know is the plans by Dubai and UAE government to send people back home, and all this, they're doing from this humanitarian project. It would be great to see the Nigerian government also pull their weight and do that as well. But as I speak, there's no official announcement from the commission here. I'm also told that there's another flight that will land in Nigeria on Friday, one of these sponsored flights. So that is what I can tell you.
Just very quickly, too, let me ask, is there any truth to the story that there are a couple of stranded people, but when approached about coming home, they express some reluctance to go home?
Well, that is contrary to what I hear and see out here. We have lots of our Nigerian youth, lots of Nigerians out here on the streets, sleeping in the open. Dubai weather right now, and the UAE weather in general, is not nice. It's not anything you want to joke with. But you have these guys sleeping out there on the road, sleeping on the trees. What I see and what I hear is a lot of people who want to go back home. And not just because they're out there on the streets, but because they're trying to take advantage of this amnesty that the UAE government has given. If you leave by such a short time, you would leave free of charge. You would not have to pay any fines for overstaying. And that's a big deal. So many of these guys, some of them whose visas expired after the 1st of March, many of them have, whose visas expired long before the 1st of March, are trying to take advantage of this grace. And I'm telling you, it's not small fees that you pay. For instance, for the first day that you enter overstay, you pay 200 dirhams. And for every other day, you pay 100 dirhams in some cases. And that's a lot of money. And it counts daily when you start overstaying. So lots of these guys don't have jobs, don't have places to stay, don't even have, 2,500 dirhams to pay for repatriation flights. They want to go home. If they get that free flight, they are definitely getting on it.
All right, then. Thank you so much, Maiwa, for your reporting tonight, and to continue to stay safe out there.
Thank you very much.
We've got just enough time to tell you that the global COVID-19 death toll has passed 750,000, as the number of cases itself has surpassed 20.6 million. The somber milestone is reached 9 months after the first cases were reported in China in December. The United States has recorded more than 166,000 deaths, and Brazil has more than 104,000 deaths.
The state is said to have exceeded a staggering 5 million, the highest in the world, with an increase of 52,839 over the past 24 hours, and a death toll of more than 165,000, according to statistics from the Center for Systems Science and Engineering at Johns Hopkins University. The U.S. has also recorded almost 1,500 more deaths linked to the coronavirus pandemic today, its biggest single-day increase in fatalities since mid-May. A top health official has warned the pandemic is the greatest public health crisis to affect the country in a century.
That's our package on our COVID-19 updates tonight. Take a closer look at some of all the numbers and indeed the stories that you've heard tonight on our website, channelstv.com. Updates are there on stories of the COVID-19 pandemic, as well as other stories, politics, business, and sports. I'm Ladi Akeridolu. Thank you for joining us, and good night.